Hi, I'm Brandy, and I would like to invite you to experience our newly renovated mammography suite at the Fairview Park Hospital Breast Center. Our breast center has its own dedicated entrance with a relaxing boutique-like waiting area. You can make your appointment online anytime at fairviewparkhospital.com or by calling 478-274-3919. Most appointments take 30 minutes or less, and we will have your results back to your doctor within 24 hours.
Hello everyone, welcome out to Fairview Park Hospital. We're here with Dr. Malhotra, and he is the interventional cardiologist here at Fairview Park Hospital. Welcome to you, doctor.
Thank you so much.
Yeah, it's so good to be able to come in and speak to you. Now, you've been in our community for several years, haven't you?
That's correct. I've been here for close to 12 years.
Wonderful. So good to have you. I hear great things about you.
Oh, thank you, sir.
From people in the community. You know, luckily I haven't had to come to you.
Yes.
So. But you know, there is that need, and when we have that need, we need qualified professionals in our community, people able to help us. And,
sure.
So thank you for that service to our community and for blessing so many people's lives. Now, when we look at February, we think of Heart Month, of Heart Healthy. So we want to come be able to speak to you a little bit about having a healthy heart.
Sure.
Many people take for granted our health until we have an issue.
That's true.
Yeah, so let's talk about the average patient, if there is one, that comes to you, and what type of scenario that may be.
Well, most of the time, I'll talk about heart attack first. People may have chest pains, they may have sweats, or they may get short of breath walking short distance. So that could be a precursor of a heart attack. So they need to take these things seriously. And the way the heart attack presents is, it can be just like bolt from the blue. It can cause you to pass out, or sometimes people just die from the heart attack because their heart starts fibrillating. The other scenario could be they may start having chest pain, cold sweats, they may become short of breath, they may become dizzy or fall down. If in the community, if you think somebody is having a heart attack, call 911 and take them to the nearest hospital.
Yeah. Time is of the essence in a situation like that, isn't it?
That's exactly right. So the reason the heart attack happens is because the most common reason is coronary artery disease, which simply means that fat builds up inside the artery, just like a pimple. So the pimple bursts open, and when that happens, all the toxins are released in the artery, which causes formation of a blood clot. So the blood clot forms, and the blood flow to the heart in that region is shut down, which causes heart attack. So the quicker we open up that blocked artery and restore blood flow to the heart, the better chances are that people will have a good outcome. They will have a near normal life in the future.
Yeah. How important is the hereditary factor?
It is important. So there are two arms to the heart disease. One is the hereditary factor, where if you have strong family history of heart disease, like if somebody in your family had heart attack when they were young, typically we say male less than 55 years of age or females less than 65 years of age. Any of your parents, grandparents, brother, sister had, that means you're at a high risk of having heart disease.
Okay.
The other part is the lifestyle that we have. The food we eat, smoking, alcohol, fast food, lack of exercise. So these are all the other risk factors for heart disease. We cannot control the genes that we have, but we definitely can do a whole lot about the lifestyle we lead.
Yeah.
So there's something we call as risk factor modification. So when we see patients, we try to decrease their risk. So if somebody has diabetes, they need to make sure their sugar stays under good control. If the blood pressure is high, they need to take their medications. They need to follow with their health provider and periodically get things checked out. Um, Smoking is a big no-no. Smoking increases your risk, not only for heart disease, stroke, lung cancer, so it's not really worth it. Alcohol is another big thing which causes increased risk of heart attack. And I know New Year comes in, everybody has a resolution, they'll start exercising, but we need to just put it into practice.
Yeah. So is exercise a good routine of exercise? Does that overcome the other obstacles?
Well, again, as I said, all these are risk factors. So the less risk factors we can modify,
Yeah.
the more risk factor we can modify, the less of a risk of heart attack is.
Mhm.
So a good exercise, you don't have to go to a fancy gym to be healthy. You can just start walking. A brisk walking for 30 minutes a day for 5 days a week. So 150 minutes of brisk walking in a week decrease your risk of stroke, heart attack, and lead you a healthy life.
Yeah. One drink a day is okay. Smoking a vape's okay. Things like that.
Vape is no. Even secondhand smoke is a big risk factor of heart disease. And drinking is in moderation. So I would not say one drink a day. I would say probably one drink a week.
Okay.
So I think, yeah, everything we have to do in moderation. When you start doing excessive amount, I think that's when we get into trouble.
Yeah. Yeah. And those signs are there
Yes.
to let you know those
Yes.
things that you said, the shortness of breath, maybe some chest pains that you have.
Yes.
And I would think stress would play a big factor.
Yes, stress is probably the factor that puts everything up front.
Yeah.
So you add stress on top of, because stress causes your blood pressure to go up. It releases a lot of hormones in your body which are not good for you. So, yeah. But again, one study was published and they said exercise is the best stress reducing medication that is there, and that is true.
Yeah.
You do exercise, it does decrease your stress level.
Yeah. And it costs you nothing.
Yes.
You
that's
get
correct.
out for the brisk walk.
Yes, that's
Yeah,
correct.
it's great advice. You mentioned earlier the different ages of a male and female. If you're looking at your hereditary, the members of your family may be affected by heart. How are women and men different with the heart?
Well, men are, throughout their lifetime, men are more likely to have a heart attack than women. But women present with atypical symptoms, they may not have chest pain, they may just feel nauseated. They may have jaw pain, or they may have pain in the back. So women are known to have atypical symptoms. Again, if the risk factors are there and something is not right, it is better to get it checked out.
Yeah, yeah. Emergencies are one thing, but if you feel that way, may they just call and make an appointment?
Yes, of course, they should call their health provider. There are several ways we can find out whether their symptoms are heart related or not. We can do a stress test where we actually, as the name says, we stress the heart and we see if we see anything on the EKG. We have other ways we can look for blood flow to the heart. There are nuclear stressors we can do. We can do EKG and echocardiogram, which gives us a good idea about the heart.
Yes. Once you're concerned with your heart, I'm sure you need to get on a routine and stay checked up.
Absolutely.
It's difficult for some people to do that, isn't it? But it's important, Doctor.
It's
Please
very
speak on that.
Yes. Well, I think that's the best investment you can do. Invest in your own health, exercise. If you have any health issues like diabetes, high blood pressure, work on those. Work on quitting smoking. Work on getting alcohol. If you have alcohol issue, get that into control. I think those help a lot.
Yeah, yeah. And we talk about diet. You know, people throw out the Mediterranean diet as, you know, if you eat that style of food, then you'll be much healthier.
Yes, I think generally speaking, I think the food industry has come a long way. Means any restaurant you go, they will tell you how many calories are in the food, how much is the fat in the food. So we need to pay attention to these things. As such, the Mediterranean diet, like you said, is heart healthy diet. Basically, if your diet has more of fruits, vegetables, healthy oils, and nuts, I think that is healthy for your heart. And again, you just have to do it in moderation. You have to keep an eye on your weight. There are all kind of apps that are available, which will, with your height and your weight, it will give you a BMI. So keep your BMI under control, and I think you'll be able to avoid a lot of problems.
Yeah, and you take into consideration different builds and what the weight that a person feels healthy at times. You going by the BMI, and you look at that, and you know that if a person works out, if they lead a healthy lifestyle, and their diet's good, even if they have a history in their family, they're doing everything they can, right,
Yes,
Doctor?
that's true. That's
Yeah.
true. Ultimately, all these interventions that we do, if I say, well, I decrease your risk by about 80-90% by doing all these things,
Right.
that's better than 0%. I'll take 80-90% risk reduction any day.
Sure. Doctor, tell me about your relationship so far with Fairview Park Hospital.
Well, Dr. Vega used to be there. I joined him, and then I've been in the community since 2011, and we have a good relationship with the hospital. We take calls and take care of the heart issues in the hospital and as well in the community.
Yeah. As we look at February being a heart month, a time to concentrate on that. Do you take any additional practices, or you try to live by the words you share? You try to live by your own medicine?
Well, I try to practice what I preach.
Yeah.
So I make sure that I exercise every day.
Yeah.
And I eat healthy every day.
Yeah.
So I think that's what everybody needs to do.
Yeah, it's great advice. We thank you so much for speaking with us.
Sir.
I trust everyone will have a good February, and let it be a month that you make some adjustments in your life.
Definitely.
Make the right choices.
Sure.
Dr. Malhotra, everyone.
Thank you so much. Bye.
'22 was another winning season at Dublin Chevrolet. Now we're gearing up for the new year. Whether it's a Trailblazer or a truck or anything in between, our selection is growing every day.
I love Dublin Chevrolet so much that I came back and bought another car.
Eli sells cars well.
Trey sells cars well at Dublin Chevrolet. And remember, go Dogs.